Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Chronic Myeloid Leukemia, CML. Introduction. Leukemia is cancer of the white blood cells. The increase in number of these cells leads to overcrowding of healthy blood cells. As a result, the healthy cells are not able to function properly. In chronic myeloid leukemia, or CML, there are too many of a specific type of white blood cell called a granulocyte. Sometimes CML does not cause any symptoms. This program explains chronic myeloid leukemia. It covers its causes, symptoms, diagnosis, and treatment options. The blood. Normal blood is made of a fluid called plasma and three types of cells. 1. White blood cells. 2. Red blood cells. 3. Platelets. White blood cells, also called WBCs or leukocytes, help the body fight infection and disease. Red blood cells, also called RBCs or erythrocytes, carry oxygen from the lungs to the body's tissues. They also take carbon dioxide from the tissues back to the lungs. Red blood cells give blood its red color. Platelets, also called thrombocytes, help blood to clot when a person is injured. By clotting, bleeding is controlled and the injured person does not lose excessive amounts of blood. Blood cells are formed in the soft, spongy center of bones called the bone marrow. New undeveloped blood cells are called blasts. Some blasts stay in the marrow to mature, while others travel to different parts of the body to mature. Chronic Myeloid Leukemia, CML. Normally, blood cells are produced in a controlled way as the body needs them. This process helps keep us healthy. When leukemia develops, the body produces large numbers of abnormal white blood cells. The leukemia cells usually look different from normal white blood cells. They also do not function properly. There are several different types of leukemia. Leukemia is commonly labeled by how quickly it develops and worsens. In acute leukemia, the disease gets worse quickly. In chronic leukemia, the disease gets worse gradually. Leukemia can also be labeled based on the type of white blood cells that multiply. Chronic myeloid leukemia affects a specific type of white blood cell called a granulocyte. Chronic myeloid leukemia usually happens during or after middle age. This type of leukemia is rare in children.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Risk factors. It is usually impossible to specify the cause of CML in an individual patient. Doctors know about factors that can increase the chances of getting cancer. These are known as risk factors. There are very few known risk factors for CML. Most people with CML have a gene mutation or change called the Philadelphia chromosome. Chromosomes are hereditary or genetic materials contained within cells. We inherit them from our parents. Chromosomes control the growth of cells. Having the Philadelphia chromosome is a risk factor for CML. The Philadelphia chromosome is created when part of one chromosome is moved to another chromosome. This causes the bone marrow to make an enzyme that causes too many stem cells to become white blood cells. The Philadelphia chromosome is not passed from parent to child. Doctors are not sure what causes the gene change. Another risk factor for CML is past treatment with chemotherapy or radiation therapy. Exposure to high-energy radiation is also a risk factor for leukemia. An example is the atomic radiation to which survivors of the Hiroshima and Nagasaki bombs have been exposed. The risk of getting CML increases with age. Often CML develops during middle age or later. Not everybody who has risk factors for chronic myeloid leukemia develops it. Some people who have no risk factors for CML will still develop the cancer. Symptoms. Leukemia cells are abnormal cells that cannot do what normal white blood cells do. They cannot help the body fight infections. For this reason, people with leukemia often get infections and have fevers. As leukemia cells increase in number, the healthy red blood cells and platelets decrease due to overcrowding. As a result, the body does not receive enough oxygen. Without enough red blood cells, a person develops a condition called anemia. Anemia causes a person to look pale and feel weak and tired. Without enough platelets, patients bleed and bruise easily. Some of the common symptoms of chronic myeloid leukemia include easy bruising or bleeding, fever or chills, frequent infections, swollen or tender lymph nodes, unintended weight loss, weakness and fatigue. Other symptoms of leukemia include bone or joint pain, painless lumps in the neck, underarm, stomach, or groin, sweating, especially at night, swollen or bleeding gums, tiny red spots under the skin called petechiae caused by abnormal bleeding. Like all blood cells, leukemia cells travel through the body. Depending on where these cells gather, patients with leukemia may have a number of symptoms. In chronic leukemia, symptoms may not appear for a long time. When symptoms do appear, they are generally mild at first and get worse gradually. These symptoms may not be caused by CML or another type of leukemia. Make sure to see a doctor to find out what is causing your symptoms. Diagnosis. Doctors often find chronic leukemia during a routine checkup before there are any symptoms. This is because routine blood tests may show there is something wrong with the blood before symptoms appear. If you have the symptoms of chronic myeloid leukemia, your healthcare provider will ask about your family medical history in addition to your own. A physical exam will be performed. Blood tests also help in diagnosing leukemia. Your healthcare provider may test bone marrow samples to find out more. Further testing may be done to diagnose one type of leukemia from another. Ask your healthcare provider about additional testing you may need. Staging. If you have chronic myeloid leukemia, your healthcare provider will determine the stage of cancer. Staging is an attempt to find out how advanced the cancer is. Stages for CML are usually described in 3 phases. 1. Chronic phase. 2. Accelerated phase. 3. Blastic phase. The chronic phase is the earliest phase, while the blastic phase is the latest. These phases are helpful in deciding the best course of treatment. CML may also be described as recurrent or relapsed. This is when the cancer has been successfully treated at least once before but has come back. Chronic myeloid leukemia can spread to other parts of the body through blood vessels and lymph channels. If you are diagnosed with leukemia, more tests are needed to determine the extent of the disease. Blood and bone marrow tests that may be done to diagnose CML are also used to stage the disease. The phase of CML a person has depends on how many leukemia cells are present in the body. A spinal tap checks for leukemia cells in the fluid around the brain and spinal cord. It is done by inserting a needle into the spinal column. Another name for a spinal tap is a lumbar puncture. Chest X-rays can reveal signs of leukemia in the chest. Other imaging tests, such as a CT scan or MRI, may also be done to look for cancer. Treatment and supportive care. Treatment for leukemia is complex. It is not the same for all patients. Treatment for chronic myeloid leukemia depends on the extent of the disease, whether the leukemia has been treated before, the patient's age, symptoms, and general health. The main goal of treatment is to stop the disease. This is called remission. The other goal of CML treatment is to prevent it from happening again or relapsing. Treatment for CML may involve targeted therapy, chemotherapy, biologic therapy, stem cell transplant, surgery. Targeted therapy uses drugs or other substances to identify and attack specific cancer cells without harming normal cells. Certain drugs may also be used to block an enzyme that causes the body to make more white blood cells than it needs. Chemotherapy is the use of drugs to kill cancer cells. Chemotherapy is usually given in the bloodstream through an IV. Sometimes it may be taken by mouth. A special kind of chemotherapy may be done to treat CML that is spread to the brain or spinal cord. This is called intrathecal chemotherapy. In this type of treatment, anti-cancer drugs are injected directly into the fluid surrounding the brain and spinal cord. Biologic therapy is a treatment that uses the patient's immune system to fight cancer. Substances are used to boost, direct, or restore the body's natural defenses against cancer. Stem cell transplants are another treatment option for CML. First, the patient's leukemia-producing bone marrow is destroyed by high doses of drugs and radiation. It is then replaced by healthy bone marrow. Stem cells are removed from the blood or bone marrow of a donor. When the cells are taken from bone marrow, the procedure is sometimes called a bone marrow transplant. The donor's stem cells are given to the patient. These stem cells grow into and restore the patient's blood cells. After a stem cell transplant, another treatment called donor lymphocyte infusion, or DLI, may be done. DLI uses a certain type of white blood cell from the stem cell transplant donor. These cells are then given to the patient after a transplant. The white blood cells attack remaining cancer cells. Surgery to remove the spleen is also a treatment option for CML. This surgery is called a splenectomy. Your healthcare provider can provide more information on the benefits and risks of this treatment option. There may also be clinical trials available for people with CML. Clinical trials test new medical approaches and treatments. CML and its treatment can lead to other health problems. It is important to have supportive care before, during, and after cancer treatment. Supportive care is treatment to control symptoms, relieve the side effects of therapy, and help you cope with emotions. Supportive care also deals with the pain associated with cancer and its treatments. Your healthcare provider or a pain control specialist can suggest ways to relieve or reduce pain.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Leukemia is cancer of the white blood cells. The increased growth of these cells leads to overcrowding of healthy blood cells. As a result, the healthy cells are not able to function properly. In chronic myeloid leukemia, or CML, there are too many of a specific type of white blood cell called a granulocyte. Sometimes CML does not cause any symptoms. Treatment for CML may involve targeted therapy, chemotherapy, biologic therapy, stem cell transplant, surgery. CML is most treatable in its early stages. Research already has led to advances that have helped people live longer. It continues to find better ways to care for people with chronic myeloid leukemia.
Thank you for using Explain.